Hi, and welcome. My name is Cheryl Soleway. You are about to embark on a very unique journey, a magical journey into your very own body. I will lead you, but you and you alone will explore your body's needs. You will discover areas of pain and pleasure, areas of tangled chaos, and areas of sheer comfort and joy. This program is revolutionary, although not entirely new. Soft tissue massage and deep releasing has been commonplace for many years in physical therapy, massage therapy, and other body therapy practices. The difference with this program is the emphasis on self-treatment through self-exploration. You are completely in charge. Small ball release works on the premise of slowly stimulating while stretching not only muscle, but everything that connects to it or around it. Pressure provided by the ball helps to create space. Space between a muscle and its attachment to the bone, space between the joints themselves, and space between muscle fibers and interwoven nerves, blood vessels, and fascia. You will need to stop seeing your body as a system of muscles and ligaments and instead see it as a complex, interwoven myriad of tissues, some which stretch easily and others which require a little more coaxing. I have attempted to keep my instructions simple, but I encourage you to learn more about small ball releasing by reading the manual available through Ball Dynamics International. In this program, we will explore a basic body routine for the spine, hips, and a little bit into the shoulders. Working up each side of the spine produces the greatest general release and neurological response. The spinal joints and connected muscles are always an excellent place to start when attempting to release any area of the body. There are some contraindications to small ball releasing which you must be aware of. Always consult your doctor before starting this or any other exercise program. Be especially aware if any of the following relate to you or your clients: a malignancy, osteoporosis, osteomyelitis, acute rheumatic arthritis, any inflammatory condition, any circulatory condition, edema or hematoma, any systemic or localized infection, any open wounds or stitches, fractures, a sensitive diabetes or blood pressure condition, and be aware and stop if ever you feel dizzy, lightheaded, or nauseous. As deep tissues are released, it is not uncommon to experience an associated emotional release. You may feel weepy or agitated or incredibly elated. Remember, each cell in your body is a living, breathing organism with feelings, memories, and yes, emotions. Be gentle with yourself. To start, you will need to choose your ball size for this day's workout. Optimally, you will need a variety of sizes, as on different days, you will feel better with either a bigger and softer ball, or smaller and harder, or somewhere in between. As a general rule of thumb, larger, softer balls should be used if you are A, a beginner or less advanced exerciser, or B, experiencing new or old muscle soreness. Larger, softer balls are generally somewhere between 7 to 9 inches in diameter. These balls have been specifically manufactured to resist bursting and also have a special bumpy texture to help promote better sensory stimulation. Smaller balls are generally less comfortable, however, do provide the opportunity for better isolation in some circumstances. Smaller balls generally require the participant to be very aware at all times as to how their body is responding. Often, I will jump back and forth between ball sizes in order to customize my workout to my particular needs on any given day. Shall we get started? Begin by sitting with the ball tucked right underneath the center of your two sitting bones, being careful not to weight bear on your tailbone. Stay here for a moment and begin by focusing on your breathing. Remember that every cell in your body requires oxygen. When you breathe, therefore, focus on breathing past the lungs, pushing the oxygen down deeper into the body. Visualize, if you can, the air pushing out against the edges of your body, most specifically at the point where the ball is making contact. Taking some of the weight onto your hands, roll your hips towards the left, catching the ball on the inside edge of your right sitting bone. Wait here. Breathe deeply and focus your attention on creating space and a gentle pull between this bone and all of the muscles that attach into it. Roll around a little bit, exploring for areas that feel blocked or restricted. Your hamstrings originate from this area, as do the muscles of your groin and inner thigh. Patiently waiting for these muscles to respond begins the process of releasing the rest of your lower body and pelvis. Unweight slightly again and begin rolling the ball upwards, trying to find the right edge of your sacrum, which is the flat, triangular bone at the very base of your spine. Visualize this edge and the connection between the pelvis and the sacrum. Follow this edge slowly, pressing the ball inwards towards the sacrum while the right side of the pelvis pulls away towards the floor. Breathe. Relax. Release. Gently begin to roll outward into the right side of the buttock. This can be a very tangled, sensitive area, so go very easy. Continue to focus your breathing into the area which is making contact with the ball. Adjust your position a little, rolling through the buttock towards your hip bone. Press. Wait patiently for a response. Slowly, roll back through the buttock to the edge of the sacrum where we began. Experiment with the positioning of your left hand. Sometimes holding on to the right outer thigh may help to position you. Continue to follow the edge of the sacrum until you reach the bony junction felt either as a dimple or bony bump where the sacrum and the ilium meet. This is your SI, or sacroiliac joint. Wait here and continue to breathe. Considered an immovable joint, in reality these bones glide on one another and only under unhealthy circumstances become blocked or immovable. Breathe and press into the ball as you exhale, visualizing a gentle opening in the space you're creating at this bony junction. Roll around a bit, listening to what and where your body is telling you to go. From here, Start to roll the ball sideways along the crest of your pelvis or ilium, stopping at any time you feel or sense a restriction. Carry on until you've rolled right onto the side of your pelvis. Straighten the right leg to elongate it. I like to hold the ball in place with my right hand, pushing it down towards the leg, while I actively pull up in the opposite direction with my ribs and side. This initiates an incredible release along the side of the body, hip, and leg. Wait here, breathing deeply. You may want to roll a little further down this side to stimulate a deep release of the tensor fascia lata. This small but mighty hip muscle attaches into the very strong and often tight band of fascia known as your iliotibial band. We will return to this area to focus on it even more towards the end of this routine. We are now ready to begin our journey back along the same path we came. Guide the ball back along the lower lip of the ilium until you are positioned back at the sacroiliac junction, that bump or dimple you discovered earlier. Leaving the pelvis, but staying on the right side, roll the ball into the space right where your low back and pelvis meet. This is your lumbosacral junction, or the space where your last movable lumbar vertebrae meets the first fused vertebrae of the sacrum. This is an incredibly important area for nerve and blood flow, muscle, and fascia attachment. Wait here, pressing the ball in towards the spine. Visualize the space you are creating, wedging an opening for the blood to circulate to the lowest lumbar disc. Visualize the slow release of tightened and restricted lower lumbar muscles and lumbosacral fascia. After a few deep breaths, begin once again to roll the ball laterally, this time pressing through the thick muscles and fascia of the low back. Move slowly. As you roll towards the waistline, avoid weight-bearing or pushing the ball into the lower ribs. The 11th and 12th ribs can be especially fragile. Move around a little. Let your body tell you where it wants to feel the release. Lift up through the rib cage, head, and neck. Slowly, begin your journey back towards the spine again. Repeat the process, attempting to roll up one vertebrae at a time. This may be difficult at first. It does not have to be perfect. If you are a beginner or using a larger ball for other reasons, it will be more difficult to isolate individual vertebrae. Once you have released at the spinal level, roll laterally, moving outwards, following the direction of the ribs. Breathe deeply. Work slowly and methodically. Stay as relaxed as possible in the arms and upper body. Gradually, work through your entire low back and associated lumbar muscles and fascia. When you sense that you are at the top of the lumbar spine and into the bottom of the thoracic spine, be aware of how capable you are of letting your lower back and pelvis completely relax on the floor. You may tip the pelvis up slightly to help stretch the back, but otherwise visualize your lower body as sinking deeper and deeper into the surface you are lying on. There is a muscle that originates from the lower part of your thoracic spine and moves upwards in a diagonal towards the edge of the shoulder blade. It is difficult to differentiate the individual vertebrae, but try to visualize this muscle being stretched from origin to insertion as you roll in and then slowly up and out. Look for the edge of your shoulder blade. Continue to work up the spine towards the middle of your upper back, always pausing at the spine. Be aware of your breathing and the movement of your ribs. An area which is blocked is not always painful. It instead simply does not move. Do your ribs move in and out as you breathe? When you have reached the middle of your upper back, pause again. Press the ball deeply towards the right side of the spine, and now gently roll it outwards towards the entire inner edge of the shoulder blade. Use your left hand, if you like, to also grab a hold of the shoulder blade and assist in the pull. Move around a bit. Think again about your breathing. Is it easy to breathe? Do you feel your ribs moving and expanding? Gently continue your journey up. You will sense a bit of a block when you reach the top of the upper back and bottom of the neck. Wait here for a minute. Adjust your arms if necessary. Allow your head to roll and unwind a bit. There is no one right position. Let your head go where it wants to go. Do not hold back. Listen. Listen to your body telling you where it wants the head to move, to release, to let go. Roll the ball along the upper edge where your shoulder blade, neck, and shoulder meet. This area is commonly a tangled web of tension. Visualize the space between your ear and shoulder increasing as the shoulder blade gently pulls away. As you move into the neck area, it is unusual, but if there is any sign of dizziness, nausea, headache, or other neurological signs, stop immediately. Always listen. Roll as far up the neck as you comfortably can. When you have reached the top, lift your head up a moment and using your hands, place the ball directly under the middle of the neck and the base of the skull or occiput area. Allow the ball to press up, opening this critical space for blood vessels and nerves to enter the head. Gently pull the chin down to assist with the traction. Stop if at any time you feel uneasy. Try to let your entire body rest completely and fully, making maximum contact with the surface you are lying on. This concludes the first phase. Remove the ball from the back of your neck and rest comfortably for a minute. What do you feel? Does one side feel any different from the other? Has your breathing changed in any way? Before we move to the left side, we are going to work on an intensely pleasurable area found right in the center of your lumbosacral area. Bridge your hips up and place the ball directly in the center of your upper sacrum, the flattened area just below your lumbar spine. Roll around a bit. If the ball you are using is quite large, you may feel more comfortable to sit up a little. Lift one leg up, then the other, balancing on top of the ball. Your arms can rest either out from your sides or hold onto the ball from beneath. Continue to roll around, moving as your body directs you, massaging this highly sensitive area. Finally, roll the ball back down toward your tailbone. Sitting up again with the ball centered equally under the two sitting bones. Breathe. Just breathe. Begin as you did on the right by rolling the ball towards the left side of the sitting bone. Push the ball up while the body pushes down. Breathe deeply and wait patiently for a minute. Move slightly as instructed by your body. Visualize the muscle origins into this bony surface. Awaken them with your pressure. Unweight a bit using your hands and begin the movement of the ball up the left border of the sacrum. Pause if ever you sense a blockage, and wait. Use your breath to expand from the inside out. Press gently into the edge of the sacrum, as well as the muscle which originates along its border. Begin to roll away from the sacrum into the deep muscles of the left buttock. Move very gently. This area so often is tight and tangled. Use your hands to determine the amount of body weight you want. Always breathe. Roll slowly and gently out towards the left hip bone. Press the ball deeply into this area. Again, take some of your weight into your hands. Roll back through the muscle towards the border of the sacrum. Pause. Use your right hand crossed over to the left outer thigh to assist with positioning. Continue to roll upwards to the sacroiliac or SI joint felt as that bony bump or dimple. Visualize the gentle glide of the bony surfaces as you breathe in and out, and as the ball pushes up while the body sinks down. Wait here. When you feel ready, begin to roll the ball along the lip of the left pelvis, gently releasing the origin of the muscle. Roll slowly and deliberately until you've reached the side. Change your leg position if you have not already, and hold the ball in place with your left hand, pushing it down while your body pulls up and away. Roll ever so slightly down towards the hip, grasping hold of the top of the tensor fascia lata. Take your time. Remain calm and patient. Give your body permission to move if that is what is telling you it wants. Slowly, begin your journey back along the direction from which you came. Pause when you reach the left sacroiliac joint. Move off the sacrum into the left edge of the last lumbar vertebrae. Breathe here, opening the vertebral space from both the inside and out. Press the ball upwards and inwards towards the muscle's origin into the spine. Sink the body down and away. Keep tilting the pelvis under to help maintain an active stretch of the spine and lower muscles. Roll slowly, deeply through the thick fascia and muscle of the lower back, and now the lumbar edge of the pelvis until you reach your side. Again, be aware of the lower ribs and be cautious not to weight bear heavily on them. Hold the ball firmly into your side or adjust slightly towards the lateral posterior aspect and stretch away from the grip of the ball. Gently but deeply roll back towards the spine. Continue to move up the lower back, then work your way out again. Do you notice any other parts of your body telling you it also feels affected when your lower back is stretched? Perhaps you feel a gentle tug in your shoulder or neck. Roll back. Attempt to move up each vertebrae, creating space and distance at each level, releasing the many muscle attachments. Always remain focused and aware of each response. Once you've reached the top of the lumbar spine and are ready to begin movement into the thoracic spine, pause to reflect on the direction you now want to move in. The lower thoracic muscles move upwards in a diagonal direction. Press deeply into the lower thoracic area, then roll upwards and outwards towards the edges of the shoulder blade. Tenderize the muscle fibers as you roll, press, and breathe. Visualize each individual fiber relaxing and elongating like a snake suddenly releasing its coils. Work your way up. Avoid any unnecessary tension and support the weight of your head with your free hand at any time it feels needed. As you reach the middle back, continue pressing the ball in towards the left side of the spine and then roll towards the inside edge of the direct center of the shoulder blade. Use your right hand to also grab the shoulder blade and assist with the stretch. Press down into the ball, allowing it to massage both bone and muscle. Be aware of your breathing capacity and ability to expand the rib cage. The area should feel soft, pliable, and movable. Work all the way up to the top of the thoracic spine and lower edge of the neck. Pause. Wait for a moment, allowing your head to move as it wishes, unwinding without restrictions. Hold the ball in place with your hand if it feels more comfortable or assists in anchoring your traction. Press towards the thick muscle covering the top of the shoulder and lower neck. Then back to the neck. Work slowly up the side of the neck as far as possible. A larger ball will feel more comfortable, but will restrict your ability somewhat to separate the neck levels. Be gentle. Remember, always be aware of such symptoms as dizziness or lightheadedness or any other uncomfortable sensation. Stop immediately if any symptoms appear. Finish once again with the ball placed between the lower edge of the skull and the first 2 vertebrae of the neck. Drop the chin to assist with the traction. Breathe deeply, opening this incredible space. How does the rest of your body feel? Are you completely relaxed? How many vertebrae in your spine are you able to press into your lying surface? Slowly, you're going to begin to roll back down the center of the entire spine. You may need to adjust your hair or clothing or hold the ball in place to get started. Begin. As needed, walk the feet in towards the buttocks, pushing your body up and over the ball. Pause at the base of the neck for at least 1 complete breath. Roll lightly over the large vertebral bump at the base of the neck, upper back, and then begin to slowly, as close to 1 vertebrae at a time as you can, to open each and every vertebrae from top to bottom. Always pause if you feel resistance or a blockage to your movement. Push the oxygen with each breath beyond your lungs into your entire thorax. Minimize any unnecessary neck tension by supporting the weight of the head at any time with 1 hand. Actively stretch the spine, dropping forward with the chin and tucking up and under with the pelvis. Climb slowly up and ride slowly down each elevation, reveling in your success. Always be patient, moving slowly along your journey back home. When you reach the lumbar spine, be especially slow, allowing each individual vertebrae to enjoy the attention. Untie every knot, unravel every rope, set your body free. Stop again when you reach that magical area on the flat upper edge of your sacrum and lumbosacral junction. Go with this. Move freely and feel the warmth created both beneath the ball and throughout the rest of your body. Enjoy and once again revel in your success. You and you alone have successfully journeyed to a place of peace and relaxation, treating your body to the release that it craves. Remove the ball and consider how you feel. What feels easier? Did your body tell you anything that you did not already know? Was there an area we did not cover that cried out for your attention? Reflect for a moment. Make your mental notes now. We are going to complete this basic program by performing a surface dive into the lower body. We're going to change dramatically from working from the back of the body to working from the front. Moving onto your tummy, slowly walk your way out, placing the ball just to the right side of your belly button. Hold it here initially. Slowly, lower yourself down onto the ball, giving your abdominal contents time to adjust and move cooperatively out of the way. Continue to breathe, allowing your body to sink deeper and deeper down onto the ball. The ball here will apply pressure and a gentle stretch to the anterior or front aspect of your deep hip flexor muscle, which attaches to your lumbar spine. Visualize the ball pressing through your body, up and out against the muscles of the back. Adjust as necessary. Use both the arms and the legs to assist with weight bearing. Roll the ball down a little further and move away from the center into the inside lip or cup of your pelvis. Like a ball and socket, visualize this inside edge of your pelvis wrapping itself around the ball. Press the ball up against this edge, releasing the often tight origin of the one-joint hip flexor muscle. Follow this anterior edge of your pelvis slowly downward towards the center of your pubis. Wait here. Feel yourself floating. Lift off the ball momentarily and place it now along the left side of the belly button. Hold it in place while you slowly lower your body down over it. Move gently, giving your abdominal contents time to adjust. You may experience a snake bite type sensation as the hip flexor muscle is stretched from this frontal aspect. Visualize the ball creating a bump out through the top of your back. Breathe and wait. Gradually, adjust your position, pointing the ball outwards towards the inside lip of the left pelvis. Wrap your body around it. Feel and sense the pull against this inner hip muscle, as well as the overlapping abdominal insertions. Lift, stretch, release. Continue along this path until you have once again reached the center. And wait. It is tempting to carry on from here into the inner thigh. However, I've chosen to lead you on one final journey down the outer thigh instead. Remove the ball from under your body and roll back onto your right side. Place the ball just under the lip of your right pelvis, as we did near the beginning of this program. Hold the ball in place with your right hand and lift up and away through the entire right side. Journey back in time and recall how this felt earlier. We are going to venture slightly further into this often tangled area, rolling the ball closer toward the hip. This area is a transition where the tensor fascia lata muscle attaches in to the very thick fascia known as your iliotibial band. Wait here at this junction, focusing once again on pushing your breath right through your body into this point of contact on the ball. Unweight yourself slightly as you roll across the hip bone and then sink once again down into the ball. Slowly, methodically, roll. Inch your way along this entire band as it travels down the side of your thigh, affecting your hip and knee, and of course all structures above and below it. This may be quite painful if you're very restricted. You may find it helpful to change to a softer ball for a few minutes until the blockages are cleared and the chaos controlled. Look for areas towards the front or back of the band. Be very, very patient, rolling as close to its insertion into the side of the knee as you feel comfortable. Remove the ball. Begin in the same way on the left. Place the ball under the lip of the pelvis on your left side. Pause and reflect as to how this felt when you were here earlier. Roll around slightly in any direction your body is pushing you towards. Gradually work down the muscle towards its insertion into the iliotibial band near the hip. Pause. Breathe. Wait for your body to respond. Unweight slightly as you move over the hip. How does this side compare to the other? Slowly inch your way along. Be very, very patient. This area often causes so many unnecessary symptoms at either the hip or knee or both. Open it. Clear the passageway. Free both muscle and fascia to function freely without restriction. Work slowly down the entire length of the outer thigh. And pause. If you are a runner, you will likely know a lot about this band of fascia. It is so often tight and tangled. How are you doing today? It's hard to stop. This feels so good. You have, however, journeyed far and will have discovered much about how your body is feeling from the inside out. I hope you have enjoyed the ride. I look forward to leading you on many other exciting explorations, diving deeper into the body's many needs for small ball releasing. Please watch for further programs in which we will focus on the upper body, chest, neck, and shoulders, and of course the lower body, working even deeper into the pelvis, buttocks, and down the front, back, inner and outer thigh. I wish you much success in introducing this amazing technique into your favorite stretching routine. Take care.